Question 1. A social worker meets with a new client who reports recent passive suicidal ideation without a specific plan or intent, but acknowledges feeling overwhelmed and hopeless. What is the social worker's first priority? A. Begin exploring the client's family history and childhood experiences. B. Develop a comprehensive treatment plan focusing on long-term coping strategies. C. Assess the client's current risk level for suicide and create a safety plan. D. Provide psychoeducation about the signs and symptoms of depression. Answer: C. Assess the client's current risk level for suicide and create a safety plan. This question tests the social worker's ability to prioritize safety in a crisis. The keyword first indicates that immediate action is required when a client expresses any suicidal ideation, even if passive. The social worker's primary responsibility is to assess the client's lethality, determine if there are protective factors or immediate risks, and collaboratively develop a safety plan to ensure their well-being before moving to other interventions. For instance, this involves asking about past attempts, access to means, and identifying supports. Remember that client safety always comes first, especially when suicide risk is present. Question 2. A social worker has been providing individual therapy to a client for several months. During a session, the client expresses a strong desire to transition to group therapy to address social anxiety. What should the social worker do next? A. Immediately refer the client to an appropriate social anxiety support group. B. Explore the client's motivations and readiness for group therapy and discuss potential benefits and challenges. C. Terminate individual therapy and process the client's feelings about the change. D. Contact a colleague who runs a social anxiety group to inquire about openings. Answer: B. Explore the client's motivations and readiness for group therapy and discuss potential benefits and challenges. This question assesses the social worker's critical thinking in adapting treatment plans. The keyword next implies a logical sequence after the client expresses a new treatment desire. It is essential for the social worker to first engage with the client to understand their request fully, assess their suitability for group dynamics, and prepare them for the new modality before making any referrals. For example, discussing fears about group participation can help build readiness. Always engage the client in collaborative decision-making when considering a change in treatment modality. Question 3. A social worker is conducting an initial assessment with a client experiencing homelessness, severe food insecurity, and chronic health issues. The client expresses feelings of hopelessness and states they are unsure how they will survive the next week. What is the most appropriate intervention for the social worker to prioritize? A. Refer the client for long-term psychotherapy to address feelings of hopelessness. B. Focus on developing a detailed budget plan to manage limited financial resources. C. Connect the client with emergency housing, food assistance, and medical services. D. Explore the client's coping mechanisms and resilience factors. Answer: C. Connect the client with emergency housing, food assistance, and medical services. This question emphasizes the social worker's role in addressing Maslow's hierarchy of needs. The keywords most appropriate and the client's immediate, severe challenges indicate that basic needs must be met first. Until fundamental needs like shelter, food, and medical care are secured, more complex interventions like long-term therapy or budget planning will be ineffective. For example, connecting the client with a local shelter and food bank directly addresses their immediate survival needs. Always prioritize immediate concrete needs when a client is in crisis and struggling with basic survival. Question 4. A social worker receives a subpoena to release a client's therapy records in a child custody case. The client has not provided consent for the release of information. What is the social worker's first action? A. Immediately release the records as requested by the subpoena. B. Contact the client to inform them about the subpoena and discuss their preferences. C. Consult with a supervisor or legal counsel regarding the subpoena. D. Assert privilege and refuse to release any records without a court order. Answer: C. Consult with a supervisor or legal counsel regarding the subpoena. This question tests ethical and legal responsibilities regarding client confidentiality. The keyword first indicates the immediate step a social worker must take when faced with a subpoena without client consent. Subpoenas can be complex, and a social worker needs professional guidance to understand the legal obligations, client rights, and the potential for a court order before taking any action. For example, legal counsel can help determine if the subpoena is valid and if there are grounds to quash or limit it. Always seek professional consultation when navigating complex legal and ethical dilemmas, especially concerning client confidentiality. Question 5. A social worker is facilitating a group therapy session when one member becomes highly agitated, raises their voice, and begins to dominate the conversation, preventing others from speaking. What is the best way for the social worker to intervene in this moment? A. Ask the agitated member to leave the group session immediately. B. Ignore the behavior, hoping the member will calm down on their own. C. Reflect the agitated member's feelings while gently redirecting them to allow others to participate. D. Directly confront the member about their disruptive behavior, emphasizing group rules. Answer: C. Reflect the agitated member's feelings while gently redirecting them to allow others to participate. This question assesses the social worker's skill in managing group dynamics. The keyword best implies an intervention that is both therapeutic and maintains group cohesion. Reflecting feelings acknowledges the member's experience, which can de-escalate agitation, while gentle redirection ensures other members' rights to participate are upheld and boundaries are reinforced. For instance, saying, "I hear you're feeling very strongly about this, and it's important to share, but let's make sure everyone gets a chance to speak," balances validation and redirection. Prioritize validating emotions while maintaining structure and ensuring equitable participation in group settings. Question 6. A social worker is conducting an intake with a young adult client who discloses being a victim of sexual assault 6 months prior. The client appears withdrawn and states they have difficulty sleeping and concentrating. What is the social worker's next step after ensuring immediate safety? A. Begin processing the traumatic event in detail to facilitate catharsis. B. Provide resources for legal action and advocacy for survivors of sexual assault. C. Assess for symptoms of post-traumatic stress disorder, PTSD, and provide psychoeducation on trauma reactions. D. Refer the client to a psychiatrist for medication management of sleep difficulties. Answer: C. Assess for symptoms of post-traumatic stress disorder, PTSD, and provide psychoeducation on trauma reactions. This question evaluates the social worker's understanding of trauma-informed care and assessment. The keyword next implies the logical progression after initial safety concerns are addressed. It is crucial to assess the client's current symptoms, potential for PTSD or other trauma-related diagnoses, and normalize their reactions through psychoeducation before delving into processing the trauma itself. For example, explaining common reactions like difficulty sleeping and concentration can validate the client's experience. Always assess and educate about trauma symptoms before directly processing the traumatic event to ensure the client is stable and prepared. Question 7. A social worker discovers that a colleague has been routinely violating client confidentiality by discussing cases in public areas of the office. What is the social worker's first ethical obligation? A. Report the colleague to the state licensing board immediately. B. Inform the clients whose confidentiality has been violated. C. Discuss the issue directly with the colleague in a professional manner. D. Document the occurrences and monitor the colleague's behavior for further violations. Answer: C. Discuss the issue directly with the colleague in a professional manner. This question tests the social worker's understanding of ethical responsibilities when a colleague's conduct is in question. The keyword first indicates the initial, least intrusive step required by ethical guidelines, such as the NASW Code of Ethics. Social workers should first attempt to resolve the issue directly with the colleague, assuming the violation is not a serious threat to clients or is not illegal. For example, a direct conversation can educate the colleague about the impact of their actions and encourage corrective behavior. Always address ethical concerns with colleagues directly first, unless there is immediate danger to clients or the behavior is illegal. Question 8. A long-term client who has made significant progress in therapy expresses a desire to terminate services. They feel ready to apply the coping skills learned independently. What is the best way for the social worker to approach this termination phase? A. Express concern about potential relapse and encourage the client to reconsider. B. Immediately schedule the final session and wish the client well. C. Review progress, discuss a termination plan, and process feelings about ending the therapeutic relationship. D. Suggest a reduced frequency of sessions indefinitely to maintain a connection. Answer: C. Review progress, discuss a termination plan, and process feelings about ending the therapeutic relationship. This question highlights the importance of a thoughtful and ethical termination process. The keyword best implies a comprehensive approach that respects the client's autonomy and reinforces their growth. A proper termination involves acknowledging achievements, developing a plan for ongoing self-care, and allowing space for both client and social worker to process the ending of the therapeutic relationship. For instance, discussing future challenges and identifying support systems can empower the client. Remember that termination is a crucial phase that consolidates gains and provides closure, so approach it with care and intention. Question 9. A client in a community mental health clinic is diagnosed with schizophrenia and has a history of medication non-adherence, leading to multiple hospitalizations. The client states they often forget to take their medication. What is the most appropriate intervention to support medication adherence? A. Increase the frequency of individual therapy sessions to process the client's feelings about their illness. B. Strongly advise the client about the serious consequences of not taking their medication consistently. C. Collaborate with the client to develop a structured medication reminder system and identify potential barriers. D. Refer the client for an involuntary commitment to ensure medication compliance. Answer: C. Collaborate with the client to develop a structured medication reminder system and identify potential barriers. This question assesses the social worker's understanding of client-centered approaches to medication adherence. The keyword most appropriate suggests an intervention that is both effective and respects client autonomy. Directly collaborating with the client to create a practical, individualized plan, such as using pill organizers or setting phone alarms, addresses the stated barrier of forgetting. For example, exploring daily routines can help integrate medication taking seamlessly. Always work collaboratively with clients to address practical barriers to medication adherence, empowering them in their treatment. Question 10. A social worker observes a supervisee struggling to set appropriate boundaries with a client, frequently extending sessions and accepting small gifts. What is the supervisor's first responsibility? A. Document the supervisee's boundary issues and report them to the agency director. B. Engage the supervisee in a direct discussion about the observed boundary violations and their implications. C. Advise the supervisee to immediately terminate services with the client to prevent further boundary crossing. D. Provide the supervisee with a list of resources on professional ethics and boundaries. Answer: B. Engage the supervisee in a direct discussion about the observed boundary violations and their implications. This question focuses on the ethical responsibilities of a social work supervisor. The keyword first indicates the initial, direct, and educational approach a supervisor should take. It is essential to address the issue directly with the supervisee, discuss the ethical guidelines, and explore the underlying reasons for the boundary struggles in a supportive, supervisory context. For example, discussing the power dynamics and potential harm of accepting gifts can be a starting point. Always address performance or ethical concerns with supervisors directly through discussion and guidance first. Question 11. A client reports feeling extremely anxious about an upcoming job interview and is experiencing panic symptoms. They ask the social worker for quick ways to calm down. What is the best immediate intervention? A. Explore the client's childhood experiences that contribute to their anxiety. B. Teach the client a progressive muscle relaxation or diaphragmatic breathing technique. C. Reassure the client that they will do well in the interview. D. Refer the client for immediate psychiatric consultation for anti-anxiety medication. Answer: B. Teach the client a progressive muscle relaxation or diaphragmatic breathing technique. This question assesses the social worker's ability to provide practical, immediate coping skills for acute anxiety. The keywords best immediate intervention and quick ways to calm down point to psychoeducational techniques that can be applied in the moment. Teaching a concrete relaxation technique empowers the client to manage their physiological symptoms effectively and independently. For instance, guiding the client through a few deep breaths can quickly reduce physical tension. When clients seek immediate relief from acute distress, prioritize teaching practical, in-the-moment coping skills. Question 12. A social worker is working with an adolescent client who is consistently missing therapy appointments and failing to complete agreed-upon tasks, despite expressing a desire for change. What is the next most appropriate step? A. Inform the client that if they miss another appointment, therapy will be terminated. B. Explore the underlying reasons for the client's non-adherence and barriers to engagement. C. Contact the client's parents to inform them of the client's lack of progress and non-compliance. D. Refer the client to a different therapist, assuming a lack of therapeutic fit. Answer: B. Explore the underlying reasons for the client's non-adherence and barriers to engagement. This question evaluates the social worker's approach to client resistance or non-adherence. The phrase "next most appropriate step" after observing non-compliance is to understand why it's happening, rather than immediately terminating or blaming the client. Exploring the client's perspective helps uncover hidden barriers, fears, or misunderstandings that may be impeding progress. For example, the client might be facing transportation issues or feel overwhelmed by tasks. Always seek to understand the underlying reasons for a client's non-adherence before moving to more punitive or drastic measures. Question 13. A social worker is facilitating a support group for survivors of domestic violence. One member frequently interrupts others, shares graphic details of their abuse without warning, and struggles to maintain boundaries in their storytelling. What is the most important action for the social worker to take? A. Allow the member to share freely, recognizing the importance of catharsis. B. Set clear group norms regarding sharing and gently redirect the member when boundaries are crossed. C. Suggest the member seek individual therapy in addition to the group. D. Ask the member to refrain from sharing graphic details to protect other members. Answer B. Set clear group norms regarding sharing and gently redirect the member when boundaries are crossed. This question tests the social worker's skill in maintaining a safe and therapeutic group environment. The keyword "most important" highlights the need to protect all group members while also supporting the individual. By setting clear norms and gently redirecting, the social worker can ensure a safe space for everyone, prevent re-traumatization for other members, and model appropriate boundaries for the member who is struggling. For example, reminding the group about triggers and asking for content warnings before graphic sharing is a practical approach. Always prioritize the safety and emotional well-being of all group members by actively managing boundaries and content. Question 14. A social worker in private practice is offered a substantial referral fee by a substance abuse treatment center for every client referred. What is the first ethical consideration for the social worker? A. The financial benefit of accepting the referral fee for their practice. B. The potential for a conflict of interest and impairment of professional judgment. C. The quality of care provided by the substance abuse treatment center. D. The client's need for the specific services offered by the treatment center. Answer B. The potential for a conflict of interest and impairment of professional judgment. This question addresses ethical boundaries and conflicts of interest in social work practice. The keyword first points to the immediate ethical issue that arises from such an offer. Accepting referral fees creates a direct conflict of interest, as the social worker's judgment regarding client referrals could be influenced by personal financial gain rather than solely by the client's best interests. For example, a social worker might refer clients to the center paying the fee, even if another center is a better fit. Always prioritize identifying and avoiding potential conflicts of interest that could compromise client care. Question 15. A social worker is conducting a home visit with an elderly client who lives alone and shows signs of significant self-neglect, including poor hygiene, malnutrition, and a cluttered, unsanitary living environment. The client insists they are fine and refuses assistance. What is the next step for the social worker? A. Respect the client's autonomy and discontinue services, as they refuse help. B. File a report with Adult Protective Services, APS, due to suspected self-neglect. C. Attempt to convince the client to accept help by highlighting the dangers of their living situation. D. Arrange for a formal psychiatric evaluation to assess the client's capacity for self-care. Answer B. File a report with Adult Protective Services, APS, due to suspected self-neglect. This question tests the social worker's understanding of mandatory reporting obligations and client safety. The keyword next indicates the action required when a vulnerable adult is at risk due to self-neglect and lacks the capacity to make safe decisions, even if they verbalize refusal. Given the severe signs of self-neglect, reporting to APS is necessary to ensure the client's safety and well-being, as their autonomy may be compromised by their condition. For instance, APS can investigate the situation and determine if the client is at risk of harm. Always prioritize reporting to Adult Protective Services when a vulnerable adult is at risk due to self-neglect, despite their stated preferences. Question 16. A social worker is working with a client who identifies as transgender and is experiencing significant family rejection and discrimination in their community. The client expresses feelings of isolation and hopelessness. What is the most affirming approach for the social worker to take? A. Encourage the client to focus on individual resilience and self-reliance. B. Connect the client with LGBTQ+ affirmative community resources and support groups. C. Help the client develop strategies to confront their family about their rejection. D. Focus therapy on helping the client accept their family's viewpoint to reduce conflict. Answer B. Connect the client with LGBTQ+ affirmative community resources and support groups. This question assesses the social worker's commitment to culturally competent and affirming practice. The keyword most affirming points to an intervention that validates the client's identity and provides external support for their well-being. Connecting the client with identity-affirming resources combats isolation and provides a sense of belonging and validation, which is crucial for those facing family rejection and discrimination. For example, referring them to an LGBTQ+ community center can provide a safe space and connection with peers. Always prioritize connecting marginalized clients with identity-affirming community resources to combat isolation and foster belonging. Question 17. A social worker is conducting a risk assessment with a client who recently lost their job and reports increased alcohol use. The client states, "Sometimes I just want to disappear." What is the first question the social worker should ask? A. How long have you been drinking heavily? B. What coping strategies have you used in the past? C. Are you thinking about harming yourself or ending your life? D. How do you plan to find a new job? Answer C. Are you thinking about harming yourself or ending your life? This question tests the social worker's immediate response to subtle cues of suicidal ideation. The keyword first indicates that safety is paramount. The statement, "Sometimes I just want to disappear," is a red flag that warrants a direct, non-judgmental question about suicidal intent to assess the client's immediate risk. For example, clarifying if disappear means wishing they weren't alive helps the social worker determine the level of threat. Always directly assess for suicidal ideation when a client makes any statement that could imply self-harm or ending their life. Question 18. A social worker is seeing a client who presents with severe symptoms of depression and anxiety, significantly impacting their daily functioning. The client has no prior history of mental health treatment. What is the best initial treatment approach? A. Begin intensive psychodynamic therapy to explore early childhood trauma. B. Focus on immediate crisis intervention and safety planning. C. Implement cognitive behavioral therapy, CBT, techniques to address negative thought patterns and behaviors. D. Refer the client for electroconvulsive therapy, ECT, due to the severity of symptoms. Answer C. Implement cognitive behavioral therapy, CBT, techniques to address negative thought patterns and behaviors. This question assesses the social worker's knowledge of evidence-based practices for common mental health conditions. The keyword best initial treatment approach for severe depression and anxiety, especially with no prior treatment, often points to interventions with strong empirical support. CBT is widely recognized as an effective first-line treatment for these conditions, as it provides practical strategies to address maladaptive thoughts and behaviors. For example, teaching thought challenging and behavioral activation helps clients manage their symptoms proactively. Prioritize evidence-based modalities like CBT as a foundational approach for common and severe mental health conditions. Question 19. A social worker is providing marital counseling to a couple. During a session, one partner reveals they are considering separating and has already consulted with an attorney, but has not told their spouse. What is the social worker's next step? A. Encourage the partner to keep this information private until they are ready to share it. B. Disclose the information to the other spouse immediately to ensure transparency. C. Help the partner process their decision and develop a plan for communicating it to their spouse in a safe manner. D. Terminate couples counseling, as the couple's goals are no longer aligned. Answer: C. Help the partner process their decision and develop a plan for communicating it to their spouse in a safe manner. This question evaluates the social worker's ethical responsibility to maintain confidentiality with individual members in couples counseling while facilitating open communication. The keyword next implies a step that respects the individual client's autonomy but also moves towards addressing the conflict within the couple. The social worker's role is to help the individual prepare for a difficult conversation, ensuring it's done safely and constructively, rather than forcing disclosure or immediately terminating. For example, exploring fears about the conversation can help the partner prepare. Always support individual clients in couples therapy to prepare for difficult disclosures, aiming to facilitate safe and effective communication. Question 20. A social worker is working with a client who is experiencing chronic pain and significant functional limitations due to a physical disability. The client reports feeling isolated and frustrated by their inability to participate in former activities. What is the most beneficial intervention for the social worker to recommend? A. Encourage the client to focus solely on accepting their limitations. B. Explore the client's past trauma that may be contributing to their current emotional state. C. Facilitate connection to a support group for individuals with chronic pain or similar disabilities. D. Refer the client for intensive physical therapy to regain lost function. Answer: C. Facilitate connection to a support group for individuals with chronic pain or similar disabilities. This question emphasizes the social worker's role in addressing the psychosocial impact of chronic illness and disability. The keyword most beneficial points to an intervention that directly addresses the client's reported isolation and frustration by fostering peer support and a sense of community. Connecting with others facing similar challenges can reduce feelings of loneliness, provide validation, and offer practical coping strategies. For example, hearing how others manage their pain can be empowering. Always prioritize connecting clients with chronic conditions to peer support groups to combat isolation and foster a sense of shared experience. Question 21. A social worker in a hospital setting is informed by a physician that a client with a severe, progressive illness has been deemed lacking in decision-making capacity. The client has no advanced directives or identified legal guardian. What is the social worker's first action? A. Respect the physician's assessment and make medical decisions on behalf of the client. B. Immediately petition the court for guardianship over the client. C. Conduct an independent assessment of the client's decision-making capacity and identify potential family members or supports. D. Advocate for the client's right to refuse treatment, despite the physician's assessment. Answer: C. Conduct an independent assessment of the client's decision-making capacity and identify potential family members or supports. This question highlights the social worker's advocacy role and adherence to client self-determination. The keyword first requires an immediate step to protect the client's rights. Before any legal action or medical decisions, the social worker must conduct their own assessment of capacity and explore all avenues for substitute decision-making, such as identifying next of kin or existing informal supports. For example, talking with the client in a calm setting to assess their understanding of their situation and treatment options is crucial. Always verify a client's decision-making capacity independently and seek out natural supports before resorting to legal guardianship. Question 22. A social worker is providing individual therapy to a client who reports being consistently invalidated and gaslighted by their romantic partner. The client expresses a desire to improve communication in the relationship but is fearful of confronting their partner. What is the most helpful intervention the social worker can provide? A. Advise the client to immediately terminate the relationship due to the abusive dynamics. B. Teach the client assertive communication skills and help them role-play difficult conversations. C. Suggest the client engage in couples counseling to address the communication issues. D. Encourage the client to suppress their feelings to avoid further conflict with their partner. Answer: B. Teach the client assertive communication skills and help them role-play difficult conversations. This question assesses the social worker's ability to empower clients to address relationship challenges constructively. The keyword most helpful points to an intervention that provides the client with concrete skills and a safe space to practice them. Teaching assertive communication and role-playing helps the client build confidence and competence to express their needs and boundaries effectively, especially when fear is a barrier. For instance, practicing I statements in session can prepare them for real-life interactions. Always empower clients with practical communication skills and strategies when they are struggling with invalidating relationship dynamics. Question 23. A client shares with their social worker that they have obtained an illicit substance for recreational use but have not yet used it. The client states they are feeling stressed and are considering using it as a coping mechanism. What is the social worker's first action? A. Immediately contact the authorities due to the client's possession of an illicit substance. B. Educate the client about the legal consequences of possessing and using illicit substances. C. Explore the client's reasons for considering substance use and discuss alternative coping strategies. D. Refer the client to an inpatient detoxification program. Answer: C. Explore the client's reasons for considering substance use and discuss alternative coping strategies. This question tests the social worker's harm reduction and client-centered approach to substance use. The keyword first indicates an immediate, non-judgmental response focused on preventing use and understanding the client's internal state. Exploring the client's stress and their motivation for considering use allows the social worker to intervene therapeutically by helping them identify and practice healthier coping mechanisms. For example, discussing specific stress triggers and brainstorming alternative stress-reducing activities can be helpful. Always prioritize exploring the client's internal experience and offering alternative coping strategies before resorting to punitive or immediate high-level interventions. Question 24. A social worker is developing a treatment plan for a client diagnosed with generalized anxiety disorder, GAD. The client expresses a strong desire to reduce their constant worrying and feels overwhelmed by daily tasks. What is the best long-term goal for this client's treatment plan? A. Eliminate all sources of stress from the client's life. B. Help the client develop insight into the historical roots of their anxiety. C. Empower the client to effectively manage anxiety symptoms and improve daily functioning. D. Focus on finding a medication that completely resolves all anxiety. Answer: C. Empower the client to effectively manage anxiety symptoms and improve daily functioning. This question assesses the social worker's understanding of realistic and client-centered treatment goals for chronic conditions. The keyword best long-term goal for GAD emphasizes functionality and self-efficacy. While eliminating stress or solely focusing on medication are not realistic or comprehensive, empowering the client to manage symptoms and improve their daily life provides sustainable coping skills and a sense of control. For example, this could involve learning relaxation techniques and cognitive restructuring. Always aim for long-term goals that empower clients to manage their conditions and improve their overall functioning, rather than seeking complete eradication of symptoms. Question 25. A social worker is providing services to a family experiencing significant conflict and communication breakdowns. The parents frequently criticize each other in front of their children, and the children often act out in response. What is the most appropriate initial focus of the social worker's intervention? A. Individual therapy for each family member to address personal issues. B. Teaching the children positive coping strategies for managing parental conflict. C. Facilitating communication between the parents to establish respectful interaction patterns. D. Exploring the historical origins of the family's communication problems. Answer: C. Facilitating communication between the parents to establish respectful interaction patterns. This question highlights the principles of family systems therapy, particularly addressing the source of dysfunction. The keyword most appropriate initial focus points to the primary leverage point for change in this family system. The parent's behavior is directly influencing the children's acting out, so addressing the parental subsystem's communication is crucial for improving overall family dynamics. For example, guiding parents to use I statements and active listening can immediately model healthier interactions. Always prioritize addressing communication and interaction patterns within the parental subsystem when it is a primary driver of family conflict and children's behavioral issues.